Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing the topic dehydration in children. So I am discussing the different questions which is useful for all competitive nursing examinations, and the topic is dehydration in children. So the first question is, which of the following is the most common cause of dehydration in children? There are four options given, that is the first one cardiac arrest, gastroenteritis, renal failure and pneumonia. Which is the most common cause of dehydration in children? So here the correct answer is option B, gastroenteritis. Now let us see the first option, that is cardiac arrest. Cardiac arrest, it is a critical condition, but it is not, we cannot consider that as a primary cause of dehydration. It can be due to some of the, in case of severely ill patients, if there is any shock or poor circulation, it may lead to cardiac arrest, and that may cause dehydration. In case of severely ill patients, if there is shock or poor circulation, that can lead to cardiac arrest, and that may cause dehydration, but we cannot say that dehydration is the leading cause. Cardiac arrest is the leading cause of dehydration. So this we are not considering as the correct answer. The next is the gastroenteritis. So gastroenteritis causes inflammation of the stomach and all intestines. So that can lead to symptoms like diarrhea, and also there can be symptoms like vomiting. Gastroenteritis is the inflammation of the stomach and intestine, and that can lead to diarrhea and vomiting. So that may lead to significant fluid and electrolyte loss, and it can cause dehydration in children. So this is the correct answer here. Now we look the next option, that is option C, that is renal failure. Renal failure can lead to fluid imbalances, but that is less common when comparing to gastroenteritis. That is less common. And also the chronic conditions which are causing the renal issues are rare in children. So that is not a major cause, but gastroenteritis is considered as more frequent than renal failure. So that is the most common cause. And next is option D, that is pneumonia. So pneumonia, while pneumonia can cause fever and also it can cause the increased respiratory rate, and it may contribute to fluid loss, but we cannot consider that as a primary cause or the most common cause of dehydration. So the most common cause of dehydration is option B, that is gastroenteritis, because of the prevalence of it, and also it can cause the direct loss of fluids and electrolytes if the patient is having, or if the child is having the problems like diarrhea and vomiting. So option B is the correct answer. Now we move on to the next question. What is the primary indicator of severe dehydration in a child? The question is the primary indicator of severe dehydration in a child. There are four options given here. Sunken eyes and lethargy. Option B, fever and headache. Option C, weight gain and tachycardia. And option D, hypertension and bradycardia. So option A is sunken eyes and lethargy, option B is fever and headache, option C is weight gain and tachycardia, and option D is hypertension and bradycardia. So this is the question and the options. So here we can analyze each of the options. The first option is sunken eyes and lethargy. Sunken eyes and lethargy are the primary signs of severe dehydration, especially in children, because sunken eyes occurs due to the loss of the fluid in the tissues, mainly around the eyes, and it can and the lethargy is mainly causing, or it is resulting from the decreased circulation and inadequate fluid balance. So that may leads to weakness and also decreased activity. So these are considered as the major cause, or commonly used clinical indicators for assessing dehydration in children are sunken eyes and lethargy. So if the early recognition of the child and also the rehydration are very important to prevent the complications. So these are the primary indicators. Now we can analyze the next option, that is fever and headache. In case of fever and headache, the dehydration can cause headache, but fever is not a typical symptom that is caused by dehydration. It can indicate an underlying infection. If the fever means if there is an infection or illness, there can be fever, but dehydration may not occur. Headache there can be headache in case of dehydration, but there is no chance of occurring the fever in case of dehydration unless there is any infection or illness is present. So that is not the correct answer here. Then option C, that is weight gain and tachycardia. So in case of dehydration, weight gain is not correct, because usually there can be weight loss in case of dehydration, not weight gain. So weight loss is a symptom of dehydration as fluids are lost from the body. And tachycardia means increased heart rate, is it? So this tachycardia can occur, but that alone isn't considered as a primary indicator. The next is the hypertension and bradycardia. So severe dehydration that usually causes hypotension, that is low blood pressure. So this is hypertension that is not occurring in dehydration. Mainly what happens is in case of severe dehydration there can be hypotension, and also the bradycardia means slow heart rate. So slow heart rate is not associated with dehydration. Slow heart rate of bradycardia is not associated with dehydration, because usually there can be tachycardia which is occurring to compensate the loss of fluid, not bradycardia. So the main signs among all these options, the main signs which are considered as the primary indicator of severe dehydration in a child is option A is the correct answer, that is sunken eyes and lethargy. The next question, which type of dehydration involve the loss of equal amounts of water and sodium? Which type of dehydration involve the loss of equal amounts of water and sodium? Options are hypertonic dehydration, option B isotonic dehydration, option C hypotonic dehydration, and option D is osmotic dehydration. So which type of dehydration involve the loss of equal amount of water and sodium? The question here is equal amount of water and sodium is lost. In which dehydration? In which type of dehydration? So the first option is hypertonic dehydration. What is hypertonic dehydration? This occurs when the body loses more water than sodium. When the body is losing more water than sodium, there can be hypertonic dehydration. So what happens? There will be more concentration of sodium in the blood. So if the more water is lost compared to sodium from the body of the child, there will be more sodium in blood. More sodium can be found in blood, and that leads to dehydration, cellular dehydration, because water moves out of the cells to balance the fluids, the extracellular fluids, higher osmolarity. So what happens is there can be dehydration, that is hypertonic dehydration, that occurs if there is loss of more water than sodium. The next is isotonic dehydration. Isotonic dehydration means there is loss of water and sodium in equal amount. There is loss of water and sodium in equal amount. So that leads to the reduction in the extracellular fluid volume, but that is not affecting the osmolarity of the blood, because equal amount of water and sodium is lost. So that is leading to the reduction in the extracellular fluid, but the osmolarity of the blood is not affected here. So the fluid lost, we can say it is isotonic compared to the body's fluid. So this is the most common type of dehydration. This isotonic dehydration is the most common type of dehydration, and which is resulting from the vomiting, diarrhea or excessive sweating. So in this topic, or in the question here is the loss of equal amount of water and sodium. So the correct answer is option B. Then what is hypertonic dehydration? So in this condition, the body loses more sodium than water. So there will be less sodium concentration, just opposite to the hypertonic. More sodium is lost from the body, so there will be less sodium in blood. Less sodium in blood or lower sodium concentration in the blood, we can call it as hyponatremia. That is hyponatremia. So this imbalance can cause water to move into the cells, that cause the water to move into the cells, that leads to cellular swelling. So that is hypotonic dehydration. Then the last is the osmotic dehydration. What is osmotic dehydration? So this is that occurs occasionally, that is the fluid shift influenced by osmotic gradients are mainly responsible here. That is, in case of uncontrolled diabetes, which is leading to osmotic diuresis. Uncontrolled diabetes leading to osmotic diuresis is mainly causing this type of dehydration. But we cannot consider this as the standard types of dehydration. Mainly the different standard types of dehydration include hypertonic, isotonic and hypotonic. So osmotic dehydration is not included in this class of standard dehydration types. So it is not a commonly recognized classification that is leading to osmotic diuresis. So that may cause osmotic dehydration, but that is not included in the standard classification like hypertonic, isotonic and hypotonic dehydration. The standard classification of dehydration is hypertonic, isotonic and hypotonic dehydration. Osmotic dehydration is not coming under this category. And isotonic dehydration is the correct answer because there will be equal loss of sodium and water, primarily affecting the extracellular fluid volume, but it keeps the osmolarity of the blood stable. The osmolarity of the blood is not affected here. That is mainly in conditions like gastroenteritis that can cause the significant fluid loss, but there is no shift in the sodium levels. So that is the option B is the correct answer, that is isotonic dehydration. Then the next question is, the preferred route of rehydration for mild to moderate dehydration in children is. Options are intravenous fluids, oral rehydration solution, subcutaneous fluids and option D blood transfusion. So which is the preferred route of rehydration for mild to moderate dehydration? So the question is mild to moderate dehydration, which is the method of rehydration, which is the preferred route of rehydration. So the first one is the intravenous fluids. So this is mainly for severe dehydration. Intravenous fluids are given in case of severe dehydration. Our question is mild to moderate dehydration. The child is, in case of severe dehydration, the child is unable to tolerate oral intake because there can be unconsciousness or vomiting or shock. So the rapid rehydration is very important in case of severe dehydration. So the main method is intravenous fluid or invasive therapy is the main effective method here in case of severe dehydration. The next is oral rehydration solution or ORS. So oral rehydration solution is the preferred treatment for mild to moderate dehydration because it is safe. It is safe and also it is non-invasive and it is very effective also. And ORS contains the balanced mixture of electrolytes and glucose that promotes the sodium and water absorption in the gut, and that is effective in managing dehydration in case of diarrhea or vomiting, which are common in children. So in mild to moderate dehydration, oral rehydration solution ORS is the preferred treatment or preferred route of rehydration. Then next is the subcutaneous fluids. So subcutaneous fluid administration, we will call that as hypodermoclysis. Hypodermoclysis, that is subcutaneous fluid administration. So that is given in case of in certain clinical situations, in case of palliative care and all, we are giving this hypodermoclysis. But in those situations, if the IV access is challenging or if it is not possible, the IV access is not possible, in that case the standard the treatment is usually given like subcutaneous fluid administration is given, but we cannot consider that as a standard treatment of dehydration in children. So that is not the correct answer. Then we have the last option, that is blood transfusion. So blood transfusion is not used for rehydration. It is indicated in conditions in case of severe anemia, and also if there is significant blood loss, any hematological disorders. So in all these conditions we are giving the blood transfusion. So this option is also not relevant for managing the dehydration. So the preferred choice is ORS, that is oral rehydration solution, because it is easy to administer, that is it can be given at home or in a healthcare setting without any specialized equipments needed there, and also it has effective absorption because ORS solutions has the components which help in the easily absorbing water. The water absorption in the intestine can be made effective, and prevents the complications, that is the regular use of these prevents the progression from mild or moderate dehydration to severe dehydration. So it prevents the further complications. So these are all some of the reasons why ORS is considered as validated by the World Health Organization as a gold standard method for the treating or managing the dehydration, mainly in pediatric patients with gastroenteritis. So that is the correct answer. Option B, oral rehydration solution, is the correct answer. Now we move on to the next question. Which is not a feature of dehydration in children? Which is not a feature of dehydration in children? The options are decreased urine output, skin turgor remains normal, dry mucous membranes, and increased heart rate. So the key term here is which is not a feature of dehydration in children. So there can be decreased urine output in dehydration. Decreased urine output is a key feature in dehydration because as the body loses the fluids, there will be decreased amount of urine that is produced. So that is an important feature in dehydration. So that is not the correct answer. Then we have option B, that is skin turgor remains normal. Skin turgor means the skin's elasticity and ability to return to the normal position. So when pinched, how much is the skin's elasticity to return to the normal position, that is skin turgor. So it does not remain normal in case of dehydration. The skin turgor does not remain normal in dehydration. So here this is not a feature of dehydration. Skin turgor remains normal is not a feature of dehydration. So that is the correct answer here, because in case of dehydration there can be delayed skin turgor and the skin remains tended for longer after being pinched. So that can be the skin turgor is lost in case of dehydration. So that is the correct answer here. Now we have option C, dry mucous membrane. So mainly in the mouth and in the nose there can be the mucous membrane will be dry. That is a common sign of dehydration. The body loses the fluids including the saliva, and that leads to dryness in all these areas. So that is the feature of dehydration. So that's not matched with the question. The question is which is not a feature of dehydration. Then option D, increased heart rate. An increased heart rate we call it as tachycardia. So tachycardia is an important typical feature in dehydration. It is a typical feature because as the volume of the circulating blood decreases, the heart try to compensate by pumping faster to maintain adequate circulation and oxygen delivery. So that is also an important feature. So we can say skin turgor remains normal is the incorrect option here. So incorrect means that is not the feature, and that is the correct answer here. Okay, so option B is the correct answer. Skin turgor remains normal. So these are the important questions. So thank you all of you for watching this video.